Okay. Okay. Great. Well, welcome everyone to the National Hispanic Medical Association's Vaccinate for All virtual briefing series. I can't believe this is our 24th virtual session. And this evening here in Washington, D.C., and wherever you are, we're going to be talking about Bienestar in Otoño, a discussion on this fall's vaccination strategies. And as we head into the holiday season, I think it's important to know the important facts that we're going to hear from our excellent speakers today as families gather around for the holidays. Whether you're trick-or-treating or eating turkey or opening presents in the holidays, I think it's good to know more information about the latest on vaccines, especially for the seasons that end up having more illnesses, especially from the viruses that we see in the fall. It is flu season. Of course, COVID-19 is still here, and we have a very special attention on RSV, with respiratory diseases, and we're going to hear more about all of those and treatments with vaccine and other treatments from our expert panel. I'm going to have them all introduce themselves, but just to tell you that we're very happy to have a nurse, a pharmacist, and a doctor. So we have a multidisciplinary team today, which is very, very, very nice for us. CME will be offered for all, I believe it's for all professionals. And I just, this is the learner notification. And we also would like you to know that it is available for up to a month after the event. In terms of housekeeping, just to let everyone know, we keep your microphones muted. This session is a roundtable format, so we encourage your questions in the Q&A box for our panel to discuss. We hope the chat box is really just for our staff internally to be able to communicate. So please put your questions in the Q&A box as you hear the speakers. We will wait till after all three speakers are done and then have the discussion. We also have a short post-webinar survey that you can answer by the QR code, or we will also email it after the event. And raffle prizes are available upon completion. The recording will be housed on our website, which is nhmamd.org, and on our YouTube channel. And the recording, the slides, instructions to claim your CME will be sent out a week after the event too. So you have no excuse for giving us evaluations or filling out your CME. Next slide. So I'm going to have our first speaker, Dr. Glowitz, talk to us about infectious diseases and vaccines from her perspective as a leader for the country from the Centers for Disease Control and Prevention. Dr. Glowitz.
Hi, I am Janet Glowitz with CDC. I've been an infection preventionist for a couple of decades and have been with CDC since 2015. Previously with the prevention response branch and the outbreak team and the hospital infection prevention team. So very glad to be here. Was asked to just speak about vaccination and hand hygiene. And so I'd like to, just begin by thinking about, well, let me ask, I'm not sure I was completely clear. Do you want me to go ahead and speak, Dr. Rios, or do you want everyone to introduce themselves first?
No, go ahead and speak. I'm going to have each person introduce themselves and then speak in one time.
I just wanted to
come
clarify
together and have
I
a discussion. Sorry about that.
Yeah. Okay, so recently I served on the SHEA IDSA. SHEA is the Society for Healthcare Epidemiology of America, the Infectious Disease Society of America, and the Association of Professionals in Infection Control as the chair of the updates for the compendium of strategies to prevent healthcare-associated infections through hand hygiene. And so I would like to talk for a minute about hand hygiene and vaccination as two foundational cornerstone interventions to prevent infections, whether you're in the community or in the hospital. Keeping hands healthy and clean is that foundational infection prevention action that every healthcare worker takes during every interaction with every person they serve. It's like putting on a seatbelt, and healthcare just is not safe when healthcare workers don't have the supplies or the time they need to clean their hands. We know that alcohol-based hand sanitizers are very effective at killing most bacteria and most non-enveloped respiratory viruses. And then some of the larger enveloped respiratory viruses, there's varying efficacy, although we don't recommend any changes to hand hygiene practices that are based on the type of organism you're trying to prevent. We know that when adherence to hand cleaning increases in healthcare settings, then healthcare-associated infections decrease. But when illnesses are spread through the respiratory route, and when individuals spread illness before they have symptoms, then vaccination becomes a cornerstone of prevention. So influenza, RSV, COVID-19, vaccination is absolutely a cornerstone activity to prevent those illnesses. Alcohol-based hand sanitizer inactivates viruses and is an example of a kill step. Vaccination provides immunity, and many vaccine-preventable diseases, get really high levels of immunity. I know that, we probably will talk about the effectiveness of the different vaccines tonight, and we know it's not 100% with either COVID-19 or influenza. However, those vaccines can reduce illness and reduce symptoms, even when there is a breakthrough infection. So these two actions provide high levels of control against infectious diseases. So are certain illnesses, certain infectious diseases more vulnerable to prevention or more amenable to prevention through vaccination? And of course, certain characteristics of the infectious agent, affect vaccine development. So for example, HIV vaccination is not yet a possibility. However, a malaria vaccine was released in 2021 and is being used in certain parts of the world. And BCG is another example of a vaccination against tuberculosis, which with low efficacy among adults, but good protection for children in endemic areas. So yes, certain characteristics of an infectious disease, really affect whether that disease is going to be highly preventable through vaccination. So one of the most strikingly important things about vaccination is that while they can prevent the target illness, they can also prevent complications of that illness. So when a person has influenza, they're more likely to develop, or they are more at risk for a bacterial pneumonia. So preventing the influenza can also prevent those secondary bacterial infections. And certain respiratory viruses, again, like influenza, when they don't match the circulating strain, can provide some cross immunity to kind of blunt the effects of an infection when breakthrough illness occurs. So with that, I will conclude and turn it back to you, Dr. Rios. Thank you.
Okay, thank you. Again, I want to remind the audience to please ask questions in the Q&A box at the bottom of your screen. This is meant to be a conversational format with the speakers giving a short or brief overview of from their perspective, the importance of vaccines. And with us next, we have AJ Ubaki, who is actually a pharmacist.
Yes, and
He's
don't
going to
worry about my
introduce
last name.
himself.
Yeah, no worries. Yeah, so my name is Anibal Lubake. You can call me AJ. My wife is still trying to learn how to pronounce my last name as well. So don't worry about that, everyone. But I'm a pharmacist. My career as a pharmacist began now 15 years ago. So I'm originally from South Florida. I went to Howard University, got my PharmD from there. Moved down back to South Florida, and I started my career with Walmart Pharmacy. Staff pharmacist, became a pharmacy manager, became part of the community, but I wanted to move on and pursue my career and to grow with the company as well. So I took on a role. I moved to Denver about 2 years ago, over 2 years ago, during the pandemic, as a pharmacy clinical services manager. And so that role supports the company and the operators in rolling out clinical initiatives. COVID during that time was a busy time for a lot of the retail community, where they had to become more hands-on on the clinical aspects of healthcare. And so I'll help roll out some of the initiatives that included COVID testing, drive-through COVID testing. We're in parking lots. In Miami, it started off in the parking lots near the airport, moved on to drive-through pharmacies doing COVID testing there, and then eventually to the rollout of the vaccine itself. And it's all its different types of vaccines that came out, and all the intricacies that came out with that, with the temperatures and all that good stuff, and the logistics around distributing that to our pharmacies. Learned a lot in that role, and quality assurance, the clinical aspect, and also making sure that our teams are supported to have the tools to be successful and to protect their communities. So with a year and a half in experience there as a pharmacy clinical services manager, I was able to become the market director here in Southern California. So I'm currently based out of LA. I support stores, pharmacies down in Southern California, from LA, Bakersfield, Ventura County, and Santa Maria. So interesting to see the dynamic. I have the LA Metro stores, right? It's a different than my rural stores in Santa Maria. I have, LA Metro Hispanic community, but I also have the rural agricultural community in some of my rural stores. So interesting dynamic there in an operator standpoint. And with that passion for healthcare, healthcare, and also for the Hispanic community and Latinx community, I'm also the regional director for NHPA. Started off as a patient education subcommittee chair. Hosted it and was a speaker on a lot of these webinars, shared my story. And that was actually my first webinar for NHMA, was kind of sharing how that drive-through COVID testing was going and what the importance was in that Hispanic community. We were using Bluetooth to talk to the patient inside their car. I was wearing a full hazmat suit. We didn't know what COVID was all about, and they needed people to translate, right? They needed people to be able to explain how to test themselves manually, how to put it into the bag. And so, coming to where I'm at now, the operator, and being able to figure out the logistics, so a team is supported to be able to do that, has been great to grow with. Also NHPA. And so supporting the Southeast, and I'll share some of the great things we're doing with our chapter there as well. But the importance of immunization goes, it's for every kind of background. So I know we're focusing here on HMA, but any community you are, there needs to be that passion around it. And so I kind of broke it down into the importance of what in the pharmacy field, right? We have the patient education side of it, with the pharmacy accessibility, right? We have free access to healthcare through our pharmacies. You can just walk in. You don't need to make an appointment. You don't need to think about co-pays, to have a conversation. And so the accessibility is very important on the pharmacy side, that we don't charge for a counseling sessions if you want to know more about immunizations. And so with that being said, we have a responsibility to provide the history and the screening. So we want to collaborate. We need to collaborate, pharmacists with other, and just like this panel, we have different backgrounds of professionalism. So we got to work with primary care providers and state immunization databases. As a pharmacist, you need to identify the comorbidities, right? If you're diabetic, If you're immunocompromised, right, you may qualify for different types of vaccines. So pharmacists must identify those patients. And then also on their lifestyles, right? As part of the community, like I said, I started in South Florida. I was part of a neighborhood market. We had a very community feel. I felt like I knew the vice mayor, I knew the sheriff. I felt like I could have even ran for mayor myself at one point, right? As you want to be, as a pharmacist, be part of the community. So someone has a family member or is having a kid or their wife is pregnant and they're working a dormitory or a nursing home. You need those lifestyle indications also to those backgrounds to be able to recommend vaccines rather than needing pneumonia or meningococcal, right? For meningitis if they're in a dormitory. So it's not just seeing something on a stat sheet or on a piece of paper. Sometimes you need to have those conversations. And that's why I think pharmacy, as that free access to walk up healthcare is important. And then public education and awareness and collaboration. Again, I mentioned NHPA, NHMA, APHA, American Heart Association. There's all these other organizations that we can partner up with. It's not solely on one organization, one corporate entity. We need to work together to identify the communities that are underserved. And then administrative measures, of course, right? How we administer. We want to make sure that we share best practices, administration techniques, and quality assurance. Make sure the storage is safe and our patients are safe. And so I think those are the major sticking points for pharmacists. And with the trend, something I'll share right now that I got some information to share, where the setting usually for immunizations was 19%, and for supermarkets or drugstores was only 19.2%. In the last 2 years, that's almost doubled to 42% year to date, or so half of our communities are getting immunized through the supermarket and drugstore setting. And so making sure that our pharmacies are well equipped and supported to do that is something that in my role right now. But I understand from the pharmacy and the front line that they need to be well trained and well educated as well. And so that our patients are well educated and feel safe when they come in, when they're offered the convenience and value that we offer as pharmacists. So that's a little bit what I wanted to speak on. And if anyone has any questions on any of the things, I love to engage on the discussion as we move through the presentation.
Sure. Thank you, AJ. And I won't even pronounce your last name right now, but I think that I have to remind people to ask questions because I don't see any questions in the Q&A box. So please type your questions. This is really about how to educate your families during this fall season, and especially because we know that the viruses tend to to become transmitted more and more to people during this season.
And I'd like to I think I have some of the chapters from University of Georgia, University of Florida on, and I want to give them a shout out real quick. But we just finished Hispanic Heritage Month, and they did two great events, one in Orlando and Apopka, and one in Pendergrass, Georgia, where they did Hispanic Heritage Month, and they joined together with the Coalition of Georgia and with the Hispanic Heritage Celebration in Apopka to educate about immunizations as well. So I just wanted to take the time to give them a shout out as well.
Oh, great. No, thank you. I think the National Hispanic Pharmacists Association has been doing great work in coordinating efforts with pharmacy schools. We now have chapters of pharmacy students that are really engaging in Hispanic education for Hispanic Heritage Month. So AJ, thanks a lot for your leadership in the Southeast and now in Southern California. So next we have a doctor from Claremore, and Soraya Sakosio. And if you want to introduce yourself, tell us a little bit more about what you do and the importance of vaccinations.
Hello and good evening. What a fantastic group to join today. My name is Soraya Sakosio. I'm the East Region Chief Medical Officer for Claremore Health. And AJ, I could not agree with you more. And listening to the story about how important hand hygiene is and how we collaborate in our community, that is absolutely critical. And go Gators. I have to throw that in there. Go Gators. I went to University of Florida for medical school, and you can't say University of Florida without following it up with go Gators. So now that that's out of the way, I want to share with this group that, first of all, this is such an important topic. And I'm so glad that we're branching out. It's not just about the flu vaccine. It's not just about the COVID vaccine or RSV. This is about all vaccines. And as we heard just a moment ago, the top two things that keep us safe and to keep us from dying are washing our hands and getting that shot in the arm. These are absolutely the most important things that you can do to keep yourself safe and what you can do for your family to stay healthy. As a family physician by training, I take to heart that we are the physicians for the health of the public. And when I started out in solo practice over 20 years ago, I did that in my office every day, and I have been passionate about immunizations and why it's important to vaccinate from the beginning. And I think this is a really important message, because before we can focus on chronic diseases and all the other challenges we have to stay healthy, we must prevent disease and stay healthy overall. Now, I've also taught family medicine residents and medical students about the importance of being engaged in the community. So AJ, when you talk about that partnership with pharmacies and walk up, I love how you say that, walk up care, that's real-time access to vaccines where people are, meeting them where they need us. So that is absolutely critical, just as primary care is. And as I transitioned in my physician experience and journey from solo practice and in the academic space, I have been a chief medical officer of several different health systems. And the message is the same, whether you're on the inpatient side or ambulatory or outpatient care, prevention comes first. We typically start with our employees and we branch into our communities, whether it's in a primary care office, whether we're sending folks to the pharmacy because that's the most convenient way for our patients to receive care, that's what's most important. And while I mentioned early on, I was engaged and active in vaccinations and why that was important as a solo physician, when I transitioned to the community space, this topic broadened not only what I shared to patients in the community, but I learned a tremendous amount about the individual vaccines, what's important. So I hope that we have questions from the audience today about what vaccines should we get? Can we get them all together? What do we need to look for? What's new with the COVID vaccines today? Important messages. I'll share a little bit more about my history. As the ambulatory chief medical officer of the largest health system in South Carolina during the COVID experience that we all had, my team was responsible for implementing all outpatient practices. How do we set up testing? How are we distributing vaccinations? We collaborated with our communities, our community leaders, and physicians and clinical teams across the spectrum of care. And this is absolutely critical as we consider the continuous relationship that we have within health systems with our patients and families. That's so very important, whether it was prioritizing who received the first COVID vaccines to how do we vaccinate up to 10,000 people in a day, and then transitioning back to a space where vaccines are routine. And this is a good thing. I'm excited that we are transitioning to perhaps a fall vaccine season in addition to year-round care that's necessary. Whether it's the RSV vaccine, the COVID vaccine, flu vaccine, it is the season. And as the East Region Chief Medical Officer for CareMore, we meet every week to talk about how are we providing access, convenience, that continuity and prevention to our patients every day. We don't wait for an appointment to receive the flu vaccine. Every appointment, we ask if you want the flu vaccine. We text patients, come in and get your flu vaccine, and we hope we can keep them healthy in other ways in the meantime. So I'm going to stop talking at this point, Dr. Rios, and hand it back to you. And I'm looking forward to the questions that we have from the audience. We also have baked in questions just in case we need help getting us started.
Okay, I just looking at the chat. So let me remind people again, if we really do want your questions, please put them in the Q&A box. And Megan, let me know if I don't see the questions. They might be in the chat box, but let me just, you've all talked about the community efforts, and I think the the issue of collaboration and partnership is important when you think about the community. You know, getting out of the doctor's office or getting out of the hospital or getting out of the, you know, what we call the healthcare. I'll just say healthcare facility, clinic, whatever. And I think that more and more people have realized the importance of community pharmacies, patient care that's at health fairs or drive-through vaccinations. But given this new information, what do you think we should do for the future without a pandemic, to be more normal with community outreach? What do you think should be done for the future that we should all support? Because I think that we need to push people to get vaccines where they live, first of all, and also what's more convenient for them. But what do you think? Let me ask Dr. Glowitz to go ahead and answer first. What are some lessons learned about community vaccination drives or
About community vaccination drives?
well, for the future, that we need to
Yeah,
have community oriented. I'm not saying they have to be drive-through. I used the wrong term. I just mean our campaigns to improve vaccine uptake, especially in our and we are a National Hispanic Medical Association, so we know how bad the information and then misinformation is to our communities, and some people and then we have people that just don't want to, or they're afraid of being deported even in some of our communities. So what would be some of the lessons learned to reach our communities easier?
the Assistant Secretary of Health of the Department of Health and Human Services has a National Vaccine Advisory Committee. So that's different than the committee that recommends the specific vaccines. It's a committee that looks at implementation. And one of their most recent reports was on increasing vaccine confidence across the lifespan. So they were addressing vaccine distrust for those receiving childhood vaccines, as well as those receiving adult immunizations. And so they have really made some nice recommendations about marketing that is culturally competent. I think AJ mentioned having vaccine clinics, in the appropriate languages, with culturally sensitive messages. So for example, there's not a lot of data about Indigenous Americans and their vaccine uptake simply because they're not studied. However, we know that as a community, it's probably similar to the Hispanic community, I'm sure, they value families and they value their entire community. And so the vaccination messages really kind of hinge on preserving their heritage and, keeping their elders safe for them to continue their customs. So, having culturally competent messages is one thing. When I was doing some research on a presentation on healthcare worker vaccination, I found many, many videos on YouTube where they were really presenting data to the Hispanic community showing that there was an inequity and just really encouraging people to come on out. And then in Denver in particular, there was a public health leader who described his experience getting a vaccine. That type of activity, I think, is very important. And so for the future, I think making sure that we have information that is accessible in languages for people. I think you raised a really good issue about fear of being deported even when coming for a vaccine. So making sure that those vaccines are offered in places that people are comfortable going. So our public health department when I worked at the county level, we partnered with the homeless shelters to make sure that, you know, those very vulnerable people had access to vaccine. And then I would mention, and AJ, you might have experience with this and provide more information, but the Bridge Access Program for the COVID-19 vaccination, so that uninsured individuals can receive free COVID vaccinations. I'll put the link to that in the chat.
Yes.
But those would be my, that's my 2 cents.
Okay.
Increasing
No,
confidence and bridging, making vaccine accessible.
That really, that's a good segue into the couple of questions up right now on the on the question and answer page. So the questions, there's 2 questions that are similar, are asking for effective strategies and communications, marketing, messaging. So I'll ask Dr. Sacosio first, but one question has to do with what's your best advice for marketing and messaging to the uninsured? And the other question about communication is the targeting the idea that there is so many people who are hesitant to get vaccines. So just, you know, if you want to take them together in terms of good communication messaging around vaccine to the hard to reach population, the uninsured who may be hesitant themselves just because they don't have insurance, but then those who really believe that vaccines aren't good or aren't in their best interest. Oh, you're muted.
Yes, I just saw that. Thank you. Thank you, Dr. Rios, for this question, because I think it's a really important one. And while I'll address one of the challenges we experience with the uninsured patient population, seeing them, hearing them, and valuing their voice in this conversation, I also will bring into the conversation underserved and all individuals who, for various reasons, may not feel seen and heard when they experience the healthcare system. So I will start there because I think this is so incredibly important. First of all, what I learned that was accentuated during the COVID challenges that we had is we have to listen first. We have to listen to understand our communities. Every community is different. And partnering with community organizations is critical, whether it's your local United Way, or if it's a Boys and Girls Club, or an organization that is trusted in your community, partner, because chances are they are partnered with those who are vulnerable. Starting there is a great idea. I learned a tremendous amount about partnerships with Hellenic societies and how they build trust with their community. I'll say that we held panel sessions for different groups. One of those, as I mentioned, was the Hellenic Society. So in particular, the African American patient population trusts and is more likely to receive a vaccine from someone who looks like them. And so we listen to that conversation. What are those fears? What is the distrust and where is it coming from? Data may work when we're speaking to scientists, improving the facts, and you always want to have the facts available. And we know when it's speaking to cultures, as we heard just a moment ago from Janet, that cultural connection is critical. Another group I'll bring up is faith-based organizations. In communities where faith-based churches or institutions are partnered, there is a level of trust that oftentimes exists, ensuring that these individuals and leaders are educated and understand what's at risk and the benefits. It doesn't necessarily have to come from me, that information. Being at the table, yes, is absolutely important, but partnering with those who are there. And I'm going to give you an example. When I was with a health system in South Carolina, and afterwards I had partnered with the National Minority Quality Forum. They have the Flu Drive program. And if you haven't heard of the Flu Drive program through the National Minority Quality Forum, I encourage you to Google them. They have seen fantastic results in increasing vaccination rates. There's a couple of ways that they have learned to be best practices. One is partnering with barbershops. And in communities where people go to the barbershop, perhaps weekly, definitely every other week, every month, this is a socialized connection. And they educated those in the barber shops, to talk about numerous health issues. Flu vaccines was one of those that we encouraged. Another was the faith-based organizations. When you partner with these institutions and you educate them with the information of why it's important, understanding after listening to what their needs are, what their concerns, and where distrust comes from, that's how you can be successful. We don't go this route alone. You heard me say earlier, it's not just a doctor's office that you can receive a vaccine. Wherever you can get it, you should get it. Perhaps it is at a pharmacy. We heard just a moment ago about the Bridges program through CMS or the Centers for Medicare and Medicaid Services. For individuals who don't have health insurance, the COVID vaccine is available for free. The health department is very important for vaccines. So taking individuals to the places where they receive care, where they trust care, is critical. And then the last thing I'll say is we lead by example. Our patients appreciate it when we say, I received the vaccine. In fact, in the last couple of weeks, I've gotten my flu vaccine. I've gotten my COVID vaccine. I'm not 60 yet, so I haven't gotten the RSV, but I've already talked to my mother about it. My mother is 71 years old, and I made sure she's been vaccinated for flu and COVID, and RSV will be next.
Well, I thank you for all those tips and how important it is to really think about partnering. AJ, I just wanted to talk to you, really ask you about the important lessons learned from the National Hispanic Pharmacists Association perspective in working with student chapters and local pharmacists in the communities. Could you let us know some of the important lessons learned, successes that you've had?
Yeah,
And
of course.
others
Yeah.
in the organization, because I know this has been a labor of love for the last few years on for Hispanic Heritage Month.
Of course. And I think the big thing is that I know when we were in the middle of the pandemic, right, we were trying to get the vaccines out as much as we could and just out in general. But I think as we evolve, we need to understand that there's no cookie cutter way to do the same thing for everyone. And I think Dr. Sacosio kind of touched upon that, is that we need to be able to, as a pharmacy, as they're a part of the community, NHPA, as you are a chapter in that community, you need to evolve to inform into what works best for that community. And so, just speaking from, South Florida, the Hispanic background in that community, or Orlando and Georgia, is different than here in California. Just the, where those communities have come from, what they've gone through, the trust in the system, the trust in the government, the trust in the medicine. And so is to tap into the leadership in those communities, whether it be religious or political, or organizations and nonprofits to work together. So something the students in the Orlando University of Florida chapter and University of Georgia chapter have done very, very well is collaborating with other organizations, or whether they be Hispanic or not, at the university, and then using those connections as well to engage the community and the leaders in the community to support health events, or to bring events onto their campus. And a big part of NHPA is also developing those students into the practitioners of the future. And so education and development in their leadership skills, and be able to set up the logistics, right? And as a regional director, sometimes you want to be like, oh, well, I want to micromanage that, or I want to do that. But you want to be able to empower them to engage their own community, to set up their own events, and be as hands-off as possible. And development of those students and those leadership skills, someday one of these students will be on one of these webinars and sharing their experiences and what they're doing in their communities. So there's, I know they're going through the educational and the examinations and the practicals, that's all involved in that. But there's other intangibles that also they need to get development on, and that's being leaders as well in their profession. And leaders in their community. So I think NHPA, National Hispanic Pharmacists Association, does that very well with empowering them and letting them know what's out there as well. I'm, community based, but there's, numerous different avenues that a pharmacist can take. They can, be part of the development of vaccines in the future, right? They can go into industry. They can get into, go legislative, right? We can go talk to our legislators and keep progressing the profession of pharmacy. I think when I was in school, I think we had just started giving vaccines, but maybe 20 years ago, pharmacists were not giving vaccines, right? And before the pandemic, even our pharmacy technicians were not immunizing. And so we need to be able to support, the entire immunization and opening more doors for our patients. And so NHPA, our members are students, pharmacists, pharmacy technicians, and anyone that wants to be involved that's passionate about Hispanic or not, it doesn't have to have a Hispanic background, but passionate about helping those underserved communities. So that's something that our chapters have done very, very well. And then on the operations standpoint, as we service our individual communities, again, finding those leaders and then identifying that not all, just because you're Hispanic, not all Hispanic communities are going to be the same. Not all Black community is going to be the same. My market in particular has a rural side, and then they have a metro side. So how we market to those are going to be totally different. Working with the the Agricultural Workers Association, right? Building the trust with those leaders in that organization. Saying that, we're a pharmacy that you can trust, or working with the public health, being able to get these immunizations out to them, would be very important versus the message in the metro, right now, a big thing is Medicaid redetermination, where, people used to be auto-enrolled in Medicaid during the pandemic. But now a lot of our patients don't know that they actually have to requalify. And so I feel like we're in danger of losing a lot of access to healthcare if they don't get requalified. And so getting that message across, whether you're a pharmacist or not, any healthcare professional is going to be very important. And so, it's going to be a multifaceted approach, I think. And that's how it evolved from the COVID pandemic stages, where we were just trying to get everything. Hey, we're going to set up clinics everywhere. They're all going to look the same. But now we can take a more multi-focused approach.
Yeah. Okay. Well, I have to say something that you mentioned, the importance of the uninsured and Medicaid. Well, you were mentioning Medicaid unwinding, but I think what's most important, it may be a hook, right, to get people to think about their Medicaid applications, is that they get free vaccines. The Bridge program that was mentioned is the Department of Health and Human Services answer to, everything's being stopped for COVID-19 in terms of the public health emergency. So now we're going to see a normalization approach and people having to pay for vaccines. But those in our communities that are on Medicare, Medicaid, the Children's Health Insurance Program, and those who are uninsured are still going to be able to have free vaccines because of the important role of the federal government's public health departments connected to the state and county health departments. So maybe that could be a way to encourage people to think about getting their vaccines. And did you know that you were on Medicaid and you should re-up and reapply, and how important it is to know that you have to reapply now. And I think the other item that people don't realize is children can stay on Medicaid longer than let's say pregnant women or others. So there's a difference, but you might want to think about that in encouraging people to take their vaccines, to get their vaccines. But let me just ask Dr. Ibaki, just one thing. You mentioned quality assurance with vaccines. Could you explain that? Is that just for you, for pharmacist world? I mean, we have quality everywhere now, but what did you mean by having to focus on quality assurance?
Yeah, of course.
In your role.
And the pharmacist's role, right? We want the public to trust in the vaccines that are being provided. And so having quality assurance in our program, and I'm talking in general and more generalities, is making sure that from the time we receive it and making sure the quality is not compromised and all the temperature and all that is one part.
Right.
But making sure that our patients also know the risks, and we don't try to sugarcoat, right? There could be side effects, right, of something. You might get a headache, you might get a fever. My child got a second dose of his flu vaccine this morning. The nurse says, he may get a fever, might want to need to get him Tylenol, right? And be transparent, because that's how you're going to build the trust. And then if there is an adverse event, knowing that our pharmacists know to, you know, how to report that, so that, you know, so that we can keep track of what adverse events happen from a vaccine, so we can know in the future, right? From VAERS, I was looking for the organization name who would report any adverse event. So making sure that that quality assurance process of it as well. And I think the manufacturer and how we're receiving now is different than before, where it used to be multi-dose vials and we had to use it by a certain time, and you waste any vial and used to waste vaccine. I think the great thing about the new shipments we're getting in pharmacy is that they're single dose vaccines, and you can literally use the syringe and you put it in there, and it's much quicker. You don't have to draw it up or reconstitute and all this stuff. So I think we've gone a long way from where we were. But that a big part is that making sure we don't lose trust in the public by not making sure we have quality assurance things in place. And you know, and so that's how kind of what I was alluding to.
Okay. Dr. Glowit, since you're at CDC, could you let us know the websites to go to for basic information on hand washing, sanitization, and all of the prevention activity, but also vaccines? And you're on mute.
Yes, thank you so much for asking that question. I love that you asked me about the hand hygiene website, and I do want to caution those who are listening that CDC has two hand hygiene websites. One is hand washing, and that's put out by the Division of Foodborne, Waterborne, Environmental Disease Branch, and it focuses solely on hand washing and is not intended for healthcare settings. And so if you are looking for information on hand hygiene in healthcare, you want to Google those words, hand hygiene in healthcare settings. And there you will find that alcohol-based hand sanitizer is the preferred method to clean your hands in most clinical situations. And there are lots of resources there for education. There are resources in Spanish, not other languages. And there are resources to communicate with patients as well. And then I have many, many sites on vaccines at CDC, whether that be the vaccine schedule. I think one of the things that you were hitting on was misinformation and disinformation. And I think it's important to recognize that disinformation is designed to get an emotional response. And so having stories about receiving vaccine can be one effective way of kind of disarming those stories. When I got my COVID, so I put in the chat, I got my COVID, flu, and shingles vaccine in one visit to a retail pharmacy. And the pharmacist said, CDC says you can get them all at once. I don't know about that. She said, babies, they just sleep all day. Adults, I don't know. I said, well, if CDC says it, I'm going to do it. and I was fine. One of my arms, the pharmacist let me know that she was giving one vaccine a little lower in the arm and that I might have more pain. That was very helpful information for me. And my arm was a little more sore on the side that I got my COVID and my flu vaccine, got the shingle shot in the other. She also was funny. She said that at the beginning of COVID-19 distribution, everyone had side effects like their toes fell off and all of that kind of thing. She said, but now, you know, we have more data. And so one of the important sites I will put in the chat is VSafe. So VSafe was an important tool for COVID-19 vaccination. It is now available for RSV. And for me, even as a patient, so behind the scenes, I know that CDC pays close attention to those reports that come in. I mean, I can assure people of that. We actually see those reports, and you'll see manuscripts and publications about them. But these are very important sites that help people report that maybe wouldn't have used an adverse event reporting system. And then when people think about vaccine adverse events, they tend to be very frightened, and often they misinterpret data that's on the CDC website, particularly about, say, deaths following COVID-19 vaccine. And they need to understand that those are the site I'm thinking about in particular, was discussing all deaths for all causes following COVID-19, vaccination, not just because they had the vaccination and then they died. These are people who might have died anyway. But the CDC systems for detecting those adverse events are very sensitive. And that is why we were able to detect the complications following the Johnson & Johnson vaccine, which is no longer on the market. So it's really helpful, I think, for people to know that safety happens before the vaccine hits the market, while it is being tested, and post-market. And then AJ, I really appreciated your point about adverse events. They do happen. People do have sore arms. People do rarely, but do get shoulder injuries after vaccination. Sometimes tragic things happen after vaccination. Those events are rare, much more rare than illnesses, resulting in death. So I will put the Be Safe site in the chat, and then there are a couple of other sites that I will put in the chat
Thank you.
with information about vaccines. Thank you.
Okay, and Dr. Sicosio, there is a question, a couple questions actually about the importance of information distribution for vaccines, but most importantly, do you have any comments or suggestions on best practices relating to information distribution for vaccines? For more people to learn from what you're doing or CareMore's doing, or how you link to educating people on how to actually increase the uptake of vaccines?
That is an excellent question. And we know there's plenty of data available. We heard just a moment ago from Dr. Glowitz about the CDC website. That is what I always turn to. The CDC has the most updated information. However, that being said, people receive information in all different kinds of ways. And I believe it's important that not only are we connecting with patients through medical sites or the CDC, the public health site I refer to often, also in our communities. What message are we sending? Who are we partnering with in the community? I think it's important to speak in plain language that everyone understands. And I think the most important conversation is understanding what's important to the individual. While we treat the community, we serve each individual, be it in the exam room, a drive-through, a retail pharmacy, wherever you receive that care. So where I usually start with the conversation is, what is most important to you? What does health look like to you? And invariably, I can relate this back to why vaccines are important. But again, it's not because the doctor said so. It's because it makes a difference, for example, in your diabetes. For patients who, for example, myself, my son has a cello performance tomorrow evening, my daughter has a play performance this weekend, and I have family members coming into town. So it's important to me that I was having the conversation with them. Gee, I hope we can all get together and everyone is well. Wouldn't it be awful if someone got the flu or if someone got COVID? Have you gotten your vaccine yet? Is there anything we can do to make it easier for you to get that? So again, keeping the conversation real and lively based on what is important to people day by day. Now, I will say on a health system level, or for our organization at CareMore, we come together and share universal language for why getting the flu vaccine, for example, is important. It keeps you well. It keeps you out of the hospital. It can actually save your life. If you have diabetes and you get flu, you're at increased risk for heart attacks or strokes. This is language patients understand. But again, it's not enough to say it in the exam room or put a poster on the wall. It's important to outreach to patients, whether it's a phone call, it's a text message, it's through their church by partnering with faith-based organizations. I've also seen where it's extremely helpful, in particular in Latino communities, to partner with the local grocery stores. Everyone goes to the grocery. And this is where we discovered a lot of information is shared. Again, meeting people where they are in a language that they understand and in a way that they care.
Thank you. Yeah, just to say a couple things, we've been, the National Hispanic Medical Association has been fortunate to be supported by CDC's vaccination efforts. And again, we call our campaign Vaccinate for All. And that was because we just saw when the vaccine drive started from different places, and they were coming out from the ad council and just different marketing tools. The National Academies of Sciences had meetings on how should we address our underserved communities and how do we get the most bang for the buck, and in communicating the importance of vaccines. And everybody was talking about how it was your responsibility individually. And so we took it we thought, well, it's not true in the Latino community, it's about the family. So what you're talking about, and just around the dinner table or around celebrations, people coming together, for your performances and plays that you're talking about, it's so important to think about everybody, not just the individual getting the vaccine, and encouraging anybody that comes into your pharmacy or into your clinic to let the rest of the family come in too and get the vaccines. And one of the other lessons that we learned, and this was, we had another activity where we worked with Congress offices to identify community organizations that really do get to a lot of people, because the Congress, we're coming from Washington, D.C., we know how important the politicians have to make sure that they are in the community or they won't be reelected, right? I mean, that's just part of policy making and that we're involved with. And so we got funded for certain areas of the country that had more underserved communities, but with higher rates of being unvaccinated. And so we went to Congress offices. One area was Houston, one area was Chicago, another area was Oakland, California. These were, certain targeted areas. I think NIH also gave a lot of funds to certain states, to researchers to actually get engaged with community. But the states that had the highest rates of unvaccinated people, no matter who they were. And I think it's not only important to know who's a trusted organization in your communities, but communities that have long-standing records with reaching people. Faith-based is an example, but others are women's groups or community groups that don't necessarily they're not healthcare professionals, let's just put it that way, but they can get to the community. And I think that's what's really important, and lessons learned from our perspective with the supports that we had. We had to think fast and how to be effective and show an impact. And with metrics too, with social media, with a lot of social media now, and you can really, show the impact. And I think data collection in general is very important, and so that we can continue to build on lessons learned. So with that, I don't see any other questions in the Q&A, and I'd just like to ask each of you if you have a final comment on encouraging people to get their vaccines this fall, and if there's another message you can give. I'll just go ahead and Janet, you want to start?
Thank you. I did see one question in the chat that
Okay.
we may have missed, and it was just, what languages do you recommend to translate vaccine messages? So I'd like to speak to that.
Sure.
And let you know that the state of Maryland actually translated much of the Project First Line learning materials into a variety of languages. They used the Census Bureau to identify the languages most spoken in their communities, so the American Community Survey, and that was how they determined which languages to use. We would like, the vaccine information statements are available in many, many languages, but they don't give you the gist of why you should get vaccinated, so, of course, we would encourage those messages to be translated into the languages that are most used in your communities. And yeah, so as we close, I just want to thank all of you for reaching out about vaccination. For those of you who provide vaccinations, thank you for making it easy to get the vaccine. And thank you for focusing on communities that are vulnerable and that need vaccination. Thank you very much.
Dr. Sicosio?
Yes, thanks so much for having me participate in this panel today. What a fantastic group. And I want to remind everyone how important it is to listen to the individual or the family. Dr. Rios, I'm so glad that you said that, because family is critical. And sometimes the decision maker or the one who's most influential may not be the patient themselves in some of our communities. And so that's very important to include the family or the caregivers in this conversation. But listen to understand what is important to the patient and meet the patients where they are, build trust and encourage. Don't be afraid to encourage. I recommend the vaccine. Sometimes I think we make the mistake by saying, do you want to? Do you want it? Which, yes, it is a question, but it's how we frame it and strongly encouraging. When it's coming from someone they trust, they will listen and they do want your advice. At the end of the day, it is the patient's ultimate decision. They're looking to us, people they trust in their community, to help them make good decisions for their health.
Thank you. And AJ?
No, a great discussion all around. And, I know the importance is like you said, Dr. Sicosio's family aspect of it. Why is it important is, the holidays are coming up. We have Thanksgiving around the corner, we have Christmas. The tendency is to wait till the temperature changes. I think we were on the panel before we jumped on this and we're like, oh, it's beautiful. It's 80 here in DC, right? And so, here in Southern California, I think we had a little hot spell. And so people, I feel like, are waiting till it gets cold, but it may be too late. You're already going to be with your family. So don't, not only is it protecting yourself, it's protecting your loved ones and your family and your friends. And so that's a big part of why it needs to be done sooner than later, being vaccinated. And for our healthcare professionals, you may not get any engagement from the patient on the first try, but again, we have to build that connection with the patient and explain the whys behind the importance of the vaccine, of all the different types of vaccines. And the only way to identify what vaccines they need is to build in that connection and knowing their background, knowing about not just their name and date of birth and their medical condition, but knowing their background. And so with that note, I just want to thank the panel, thank our those who joined on the call. It's been a great discussion.
Yeah, I want to thank all of you too. And we have a few slides just to end the program. Here you go. So we have our Vaccinate for All, and we have champions who can be individuals or organizations. And we've been building a database where we can just send more information out or invite people to these webinars. So we invite you to sign up for our Vaccinate for All. And then in terms of some upcoming events that we have, our foundation, NHHF, National Hispanic Health Foundation, we're starting to give out some scholarships locally now, not just the galas that we have in New York and Los Angeles in November, but locally in the other regions, we're going to have receptions. And so Washington, D.C. is our first reception for scholarship, November 1st. November 4th, we have a chapter meeting in Nevada, and that is actually online. These are all on the QR code, but it's virtual. Nevada has 2 medical schools, one in Reno and one in Las Vegas, and they get together virtually. So that's the Nevada chapter. These are doctors and medical students and any other health professionals, and they're very engaged actually with the public health departments in Nevada. And then November 11th, I see exploring what is it? Tri Protection Twitter chat. Okay. And then November 17th, that is our California Gala for scholarships. And then the 30th, November 30th, which is not there, is the New York City Gala. And we've been giving scholarships to health professional students, pharmacy, public health, nursing, dentistry, medical, and PA for quite a few years now, and really enjoyed helping the next generation. And so I hope that my message as we close here is how important it is that all of you are reaching the next generation through your efforts, through your organizations. And we have to make sure that as doctors and nurses and pharmacists do grow older, that they continue to pass on the lessons learned. And we've all lived through a historic period of this pandemic and now know how much more people are asking about vaccines and asking about medications to not to be so sick, because they saw hospitalizations and death in their family like no other time period in our generations, I guess 100 years, right? Since the last big Spanish flu problem in the country and pandemic. So anyway, thank you all again. And I guess, and if anybody's interested in our National Hispanic Medical Association, we do have a membership again to build mentoring and support and networking on really how to take care of our communities. That our mission has always been to improve the health of Hispanics and other underserved. It's not so much about our professionals, it's really how we learn from Latino doctors or Latino pharmacists, et cetera. But it's for the non-Hispanic who we consider Hispanic serving. And we very much agree with what everybody said tonight, that it takes all of us, all the different health professionals working together to be on the same page and encourage our patients to be safe and to be healthy and to get vaccinated. So thank you very much. And please remember to complete our post-webinar survey to enter into Vaccination for All t-shirts. Thank you. And thank you, Megan.